Hey gang, welcome back to another episode of the Rotator Expert. I'm Dr. Daniel Orcutt, board certified orthopedic surgeon, and today we're going to talk about the 5 pre-surgical mistakes, which means the 5 mistakes we want you to avoid making when you're getting ready for surgery. Okay, so surgeries are obviously a really big deal. We have lots of moving parts as far as scheduling for the doctor, for the patient, for your life, for your work, for your family. So there's a few things we need to try to do our best to not make mistakes so we can actually get the surgery done so it doesn't get canceled. And so make sure we get it done right and efficiently and successfully. So the number 1 is the wrong doctor. I know it's hard for me to say as a surgeon, but there are doctors that should be doing your surgery. There are doctors who should not be doing your surgery. So you really need to make sure, you need to do your homework to make sure, 1, you like them. You should like them. Even just a little bit, you should like them. You should feel comfortable with them. You should make sure that they've done your surgery enough times. And ask the question, well, how many of these do you do? Is this a new thing for you? Have you ever done it before? There's an interesting article that came up, and the doctor decided to do one of his first surgeries he's ever done through a different approach. And that's not who you want to be with. If I'm gonna do something for the first time, I'm not doing it on you, I'm doing it with my partner who knows how to do it with somebody else, right? We wanna make sure you're seeing somebody that has the experience that you would want. The experience that has done many of the operations, so you feel like they know how to do your surgery. They know when things aren't going quite right. They know how to fix the things that are not going quite right. So make sure you get the right doctor. It does really matter. It's okay to have a second opinion with a doctor, right? Because that means there's some kind of disconnect between me and my patient. And the last thing I want is to have a disconnect right before we do surgery, because the surgery is going to be hard. I want you to trust me. I want you to believe that I have the best intentions for you. If you don't, then we really want you to see someone else. So that's 1 thing, wrong surgeon. 2, rush. Rush means you're going into the process too fast. You say, okay, let's go. And maybe, just maybe, there's other options before surgery. Maybe you haven't done any therapy. Maybe you're not having a lot of pain and you want to go, well, I don't know, I have a surgery, I have an injury to my shoulder, but maybe I'm not quite ready. If you're not quite ready, that's okay. We know that there's not an emergency to do a rotator cuff repair. Is there urgency? Maybe. Is a sort of an important time frame? There is an important time frame within months, but it's not within weeks. It's certainly not within days. If you have a shoulder that you got injured, you have some time to think about this, think through this, to plan it. Make sure you're taking time with your family, your friends, and your work so they can help you. And if we need to take another week or 2 to get that set up, we should get that set up, because if you don't and you're not ready, then you could jeopardize the recovery, and we don't want to do that. So think about that. Take your time when you're starting to think about doing surgery. There's no rush. 3, be prepared for surgery. There are some things that you need at home before and after surgery to make sure you're ready and make sure you're prepared, make sure you can have this as successful as possible, because the last thing you want to do is to do this over again. And so I'm going to link to some top products, and I'm actually going to do a video after this series. We're talking about top products. So there's things that you can do to be ready. And some of the things that you can do to be ready is actually watch some of my videos. The top products video, the spouse or significant other video, the shower video, the what to expect of PT video. Those are really important. I have over 100 videos. There are things that I think are really important that it's hard for doctors to tell you about. There's not enough time in the day. There's not enough time to spend with patients to say all these details. The videos are really important to watch, so be really prepared for your surgery. We'll put the videos that I have specifically the 4 videos that I think are important for this moment. Top product, spouse, significant other, shower, and PT. Those are good videos that you should watch before. Medicines. Now, medicine I think is crucially important, and I still have patients that don't do this quite correctly because they're worried, right? They're worried about medicine, they're worried about pain medicine, they're worried about taking it too soon, they're worried about becoming addicted to narcotics, which I understand. But make sure you follow the directions that your doctor says when you should take the medicine. And lastly, make sure you get your medicines before your surgery. Don't show up on the day of surgery and say, hey doc, I haven't got my medicines yet. That's a problem, because lots of times, or in my practice, I want you to take them the night of surgery, and to try to get them between your surgery and the night that you go to sleep after surgery is really hard. And sometimes, especially in this narcotic crisis we have, sometimes the pharmacies don't have your medicine, so you have to go to different pharmacies. 1, I would ask your doctor if you can get your prescriptions at the pre-op visit. So it's usually a week or 10 days or 2 weeks, something like that, before your surgery. So get those prescriptions before and then go get them soon. Don't take them, right? It's not a point of trying to take them before surgery. Just have them with you so you can have confidence that you have all the medicines they want. And there are different medicines that I give and other medicines that other people give, but you want to make sure you have all the medicines. You want to get that all buttoned up before you even get yourself to your surgery. And then lastly, medical clearance. Medical clearance often is a problem because patients maybe think that they don't really need medical clearance. They're pretty healthy. They haven't had any medical problems in a while, but it's super important. You have to get medical clearance. You have to go to your medical doctor. Yes, I know it's a cost. You have to go there and you have to pay a copay to see your doctor. You're going to have to get some stuff, maybe EKG, blood work, whatever. But it's really, really important to get that together because the last thing you want to do is get to surgery. Anesthesiologist says, we don't have the clearance. We don't know. We don't have the information. We don't know if it's safe. So we're going to cancel you. The last thing you want is the day of surgery, not be able to have surgery because you don't have medical clearance. Okay, so wrong surgeon, rushing it, make sure you prep, and then make sure you get your meds ahead of time. Make sure you get to your primary care doctor ahead of time so you get cleared. So I hope this is helpful. This is really important. The last thing you want to do is make mistakes before surgery because that makes it hard to recover after surgery. Thanks.